Good morning, all. We will get started momentarily. For those of you who are raising your hands with questions, please feel free to drop your questions in the chat box and we can respond to you. Thank you. Okay, good morning, good afternoon. We are going to go ahead and get started here with this webinar. I am Lindsay Denny, the Health Advisor for Global Water 2020, and I'm privileged to be here this morning to moderate this webinar on Washington Healthcare Facilities, the fifth and final seminar on sanitation in this series focused on Washington Healthcare Facilities and COVID-19. Just a reminder that all the slides will be available on washingtonhcf.org, the website. Under the resources section, you can search COVID-19. And the slides for this session will be up tomorrow. If you haven't already signed up for the WHO and UNICEF newsletter, you can also do so on the website. The recordings of this webinar, as well as previous webinars, can be found on the WHO and UNICEF YouTube channel if you search WHO, UNICEF, WASH, and HCF. A quick bit of guidance around WebEx. We welcome you to use the chat box function throughout the presentation. Please feel free to introduce yourselves using talking about your job and location, posting questions. And if you could please post your comments to all panelists, that way all of us presenting can see your questions and respond to them. Unfortunately, due to webinar settings, we are unable to allow the participants to chat with one another, but we will summarize your questions. If the webinar goes on long and we are unable to direct responses to all of your questions, we will make sure to respond to them in a formalized document following up this webinar. So please feel free to make sure that you put that in the chat box. So without further ado, I'd like to introduce WHO's presentation here from Maggie Montgomery and Kate Meldicott, who will give technical guidance on sanitation in the context of COVID-19, including WASH fit indicators and ideas for improvement. So Maggie, I will hand it over to you.
Perfect. Thank you, Lindsay, and thank you everyone for joining. It's great to see so many familiar faces in our fourth webinar of our webinar series. So let's get started. I know it's very early for some of you, and probably for others it's quite late, but wanted to start off with a quick quiz. There's 4 questions, and I won't read them all in full, but the first one is about the proportion of healthcare facilities with no toilet. Second question is about in healthcare facilities, for which 2 sets of groups should the toilets be separated? How close should there be a hand washing station to a toilet, and how often should the toilets be cleaned? So if you could please type your answer in the chat. I'm not sure what our prize is, but there'll be a really good prize, including announcing your name at the end of the webinar. So please take a minute, a few seconds, type your answer before I go to the next slide, which are the answers. We'll see how many sanitation gurus we have out there. Okay, so answers 2 and 5 do not have a toilet, and I think it's easy to quickly breeze over these figures, but when you think about it, that 40% of healthcare facilities don't have a toilet, the number is huge, and it's completely unacceptable. And it's also something, though, that we feel that is a problem that can be solved. We know how many healthcare facilities there are, we know where to find them, and we know what the solutions are to improving that access. As you're probably aware, the toilets should be separated for male and female. This is because of many cultural issues, but also because specifically for females, there should be menstrual hygiene facilities in the toilet, including a waste bin that's covered and a place to wash. But also toilets should be separated for patients and staff, and I'll touch on that in a moment because we are focusing this webinar on sanitation and COVID in healthcare facilities. All toilets should have a hand washing station nearby, and they should be cleaned at least daily. Okay, so many of you, if not all of you, are aware of the technical guidance that has been published recently on water sanitation, hygiene, and waste for COVID. There was an update that was published last week, so if you haven't seen it, please go to the WHO website, the technical site for IPC and WASH and COVID to see this guidance. It has a lot more information on sanitation, so you've come to the right place to hear about it more specifically today, as well as on hand hygiene. The main takeaways are still the same, that our existing guidance for WASH applies, and in particular, it's important that part of any COVID effort that we're making sure that WASH, and in particular sanitation, is included, is funded, is monitored, and is part of existing program efforts. So very briefly, just wanted to touch upon this issue of survival of human coronaviruses in feces and wastewater. We get this question a lot. Is it in the feces? Is it in our wastewater stream? This data on this table is looking at other types of human coronavirus, and we can see that the survival varies from a few days, actually a few hours in baby feces, to a few weeks. And there's lots of factors that influence survival. There's temperature, there's pH, and there's what actually happens to the wastewater or the sludge after it's collected. And we'll talk a bit about that more in a moment. Just to highlight, there are now 2 studies, I believe, that have been able to culture virus from feces of infected individuals, so we know that they can excrete it. There are many now reports of the viral fragments being detected in raw wastewater, so wastewater before it is treated. But we have no reports of it being found in wastewater that has been treated or after a period of time, which in this case would be a few weeks. So moving on to my next slide here, I'm going to hand it over to my colleague Kate Medlicott, who is managing the sanitation work at WHO. And if you could please mute, thank you, and who will tell us a little bit more about the guidelines, but also specific technical options for healthcare facilities. So Kate, over to you.
Thank you, Maggie. So hopefully you've all seen it now. We've got new guidelines on sanitation and health, which cover both healthcare facilities and communities. And what you're looking at the bottom here is just absolutely key to everything we're doing on sanitation now. So not just thinking about access to toilets, but making sure that it's safely managed along the whole chain from the toilet, containment, conveyance, treatment, and end use and disposal. There's some of that can happen on-site or off-site, and we'll get into some of the options for that. Specifically related to COVID, we want to be making sure that the plumbing is really solid. That was implicated in the SARS outbreak previously, and our guidance recommends keeping the lid down as a precaution against aerosolized particles, although the evidence on that is quite limited. We want to make sure that there's separate toilets for both staff and patients, and really importantly, a regular cleaning and disinfection program and protection for workers who are charged with cleaning toilets. And we want to be really clear that the existing treatment technologies that we have are certainly adequate, and quite often simple and practical options are available. Can I advance the slides from here, perhaps?
Hi, Kate. Yes, you should. There's a tab on the left-hand side of your screen. You should be able to advance them from there.
Can't seem to do that, I'm sorry.
I will pass back to Maggie, and she can advance this way.
Yeah, we're on the next slide, Kate.
Super. Okay, so antimicrobial resistance is also something you're probably hearing more and more about. There's a new document coming out in the next couple of weeks. Up in the top left corner, you can see there, that talks about the various ways we control the spread of antimicrobial resistance, and healthcare facilities is one of the really important places we can do that. Next slide. Okay, so what can be done? One thing that we need to be really clear about is that wastewater and healthcare facilities actually carries quite a high proportion of resistant bacteria and residues, and they're often the ones that are the last line of defense. So wastewater from hospitals is a particular concern, but it's also important to note that the existing treatment technologies we have remove resistant bacteria at similar rates to non-resistant bacteria. So it just reinforces the importance of doing proper treatment at healthcare facilities. Next slide. Okay, so when it comes to those options, we have within the guidelines a set of system fact sheets, and it covers 11 of the most common sanitation systems that would be not only relevant for health facilities but in communities as well. And these cover elements of the applicability to certain conditions. So obviously not every sanitation system is suited for every context. Design considerations, very importantly, the operation and maintenance criteria you need to be thinking of in terms of making sure that the staff are trained and skilled to provide that operation and maintenance and the cost associated with it. And the specific measures to protect public health, so both the workers and people in surrounding communities. And going with those is sanitary inspection forms, so that you can make an inspection and see where some of the key areas for improvement are with each sanitation system type. Next slide. Okay, so we'll just give some examples now. And here you see like a typical kind of toilet arrangement. What's important to remember here, of course, we're interested in making sure that people are not exposed to excreta, but when it comes to the toilet, there's a lot of other criteria that around more of the well-being aspects of sanitation that encourages use. And so these are things like locks and lights, privacy, menstrual hygiene management facilities, and in some cases, inclusion of showers and laundry facilities where that's context or sort of culturally valued. When it comes to the containment and treatment options here, this is all about preventing exposure to excreta. And there's a few examples here. So VIP, perhaps you're familiar with a typical septic tank, and one example here, which is a biogas reactor. So that's a way of recovering value from waste in the form of gas that could be used for heating or lighting. And for health facilities, I think that's the only one we can really look to. So forms of reuse, like use of wastewater in agriculture, is absolutely not recommended for wastewater from health facilities specifically. Next slide. Again, when you're getting to larger facilities with larger volumes, there's larger and more sophisticated wastewater treatment options that may be on-site or may happen off-site and be the responsibility of another service provider. But it's important for the health facility managers to know what is happening next in the chain and to see whether they need to step up on-site pre-treatment if the connections to, say, a gravity sewer or waste stabilization ponds are not providing adequate downstream treatment, which might mean that the wastewater from the hospital was potentially a risk in the community. Next slide. again, here I'm not going to read all this to you, but within the guidelines you will find quite a lot of information about the relative performance of different technology types, the kind of log reductions you can expect from different technologies, and some of the conditions that are most suitable to those treatment technologies. Next slide. Okay, I just wanted to pause for a minute on protection of sanitation workers, and again, these may be health facility staff or people that are called into the health facility to perform this function. But almost every sanitation system type is going to need emptying at some point and some maintenance. And in some cases, this may mean things, quite unpleasant things like workers having to get into pits if the material inside there is really hard and can't be removed by pumping. So there's really important risks that need to be considered for workers, making sure not only that they have PPE, but that they are trained according to proper operating procedures, and there's some formality around the employment conditions they're working under. Next slide. Okay, so another issue that we're thinking about a lot is making sure that the types of technologies that are being promoted for improvements are really climate resilient. And there's a number of climate change events that we might anticipate, whether that's more or intense rainfall, or less water, or just increased temperature in general. So you see some of the impacts that might have on sanitation here, including flooding of facilities or insufficient water to flush certain technology types, or just breakdown of systems, which can lead to higher rates of water and vector-borne disease, among other things, or even discouraging use of the facilities themselves if they're dysfunctional or really unpleasant place to use. Next slide, please. But the key thing to take from this, and you can look at the paper the discussion paper that's referenced here. But what we find in general is that simple systems like pit toilets and low flush systems tend to be more resilient, and ones that are highly reliant on large volumes of water or electricity for aeration of certain technology types tend to be less resilient. Before I hand back to Maggie, there's just a couple of kind of technical things that come up that I wanted to share now. One is around open drains. I think people often think when it comes to sanitation that the dangerous part is the sludge, the kind of the solid part, but actually liquid effluent from septic tanks is actually quite high in pathogens. So we really need to be thinking, where is this liquid effluent going, and discharging into an open drain in the local community is really not a safe option. Another thing that has come up is also around grey water. So often the water from toilets and the water from sinks and showers all ends up in the same treatment system. Something that can be considered, especially where there's a lot of hand washing and cleaning water coming out of health facilities, is to perhaps think of black water and grey water separation to reduce the pressure on those septic tanks or other wastewater treatment technologies. So next slide, I think it's back to you, Maggie.
Super. Thanks so much, Kate, for that great overview of the guidelines. And I'm going to shift to just talking a bit more about the WASH fit indicators, which also align with the global monitoring indicators for WASH and healthcare facilities, and highlight a few more points before we hand it over to some of our country speakers. So, and just to be really clear, all of the WASH fit and global indicators that UNICEF and WHO have established are applicable for COVID, as are the WHO sanitation and health guidelines. So toilets and latrines obviously need to be on site. They need to be usable, which means they have some kind of privacy through a locked door, through screens, but also accessible. And I think the accessibility part is really important to emphasize, and that means accessible to small children and means accessible to those with limited mobility. As we've stated, they should be separated, and there should be at least one that meets the menstrual hygiene management needs. And finally, there needs to be a functioning hand hygiene station nearby. And that hand hygiene station should be soap and water, because soap and water is what's recommended if there's any chance of there being any organic material on the hands. Okay, a few other additional indicators, and these are indicators that have recently been added to WashFit as part of our ongoing process to develop version 2.0, which especially for sanitation is going beyond just whether or not there's a toilet and it's usable, but looking throughout the whole sanitation chain. It also goes into more detail about climate resilient options, and Kate gave a quick overview of what those could be. So again, we've basically covered these in the talk, but just wanted to emphasize that in your work and in your facilities, it's important that if there is fecal sludge that's being held on site, that it's fully contained and is either emptying through a safe and known system, or that it's actually being treated in situ, so on site. If there's toilets and there's a public sewer system, we obviously want to make sure there's not leaks, and in particular that those leaks aren't potentially contaminating water supplies. We've seen this actually in some major hospitals, and I think that both on site, but as well as understanding that connection to a municipal supply is really important. The third one is that if sewage is being sent to a treatment plant, that it should provide at least secondary treatment, and that it is performing to the standards that have been set by the treatment plant and by the government more broadly. And secondary treatment doesn't necessarily have to be costly. There's lots of low-cost options for secondary treatment that are doable in even the most resource-scarce settings. On the stormwater, I see we already have a question about stormwater or gray water, so water that has been used for washing, for example, PPEs. It should be diverted away from the facility. As Kate said, it doesn't need to go into the sanitation system because it will quickly overload the system. It doesn't necessarily need additional treatment, but it's really important to make sure that your gray water is not mixing with your black water, or that, you know, there's a potential that there could be other sources of contamination entering it. And it's also important that wherever it's being diverted to, it's not into someone's backyard, which could cause flooding and vectors and other issues. So I think it's important that it's going into a place that it can be drained into the ground and in a site where there aren't other humans. And then just lastly, on the environment side, throughout these webinars, the biggest challenge that has been raised is the issue of water scarcity and water supplies, which affects all aspects of WASH, including sanitation. And, you know, there is the possibility to use rainwater, to use certain types of gray water for washing, cleaning, watering plants, and even toilet flushing. So would be curious today if any of you are looking at these options, especially in areas that are particularly water scarce. We had a really in-depth webinar Tuesday on cleaning, and we did talk about cleaning of toilets. This should be done at minimum daily and should have a signed record, because that serves as a check to make sure that they were cleaned. If they don't look cleaned, it's easy to go back and see who was supposed to be responsible. There obviously also needs to be a place for rapidly addressing dirty or broken toilets, and this can be done through user feedback, but also through the staff, that there's a feedback loop, that when things aren't working, they can be quickly addressed. And then lastly is just this issue of regular operation and maintenance. It's really critical. We find that the toilets often are the first to go into disrepair. So not only should there be a budget for this O&M, but either there needs to be a contract with an external entity that can do the operation maintenance, or somebody on staff that can make these quick fixes to the plumbing, to the actual physical structure of the toilet, or even aspects of the storage, and if in situ treatments happening, fixes there as well. Okay, we have another quiz, and this was extracted. We have a longer training series as part of our Wash Fit, and this was an example that was extracted from that, a real life example. So if you could just read the scenario, but basically we're talking about a small primary care facility that does births. It doesn't have very many people spending the night, but occasionally women do if they have a more complicated birth. They have a number of outpatients, and in addition, once a month there's a vaccination clinic. There's no sewer. So if you could, again, type your answers in the chat, and think about what kind of sanitation system would you recommend, and how many toilets would you put in place. So take a minute here to think about it. For the courageous, please send us your answer. We'll at least give you a proper recognition during this webinar, but there may be an even better prize coming towards you. Okay, so I'm going to move to the next one, and there could be other answers as well. And I think the important thing to think about is in any of the wash work, and in particular sanitation, there's no one prescriptive type of technology or one prescriptive type of system. That it really has to be something that is feasible, where there's the know-how, and where there's the spare parts, and where there's the budget to actually be able to operate and maintain. So the two most common things that probably this small rural facility could use would either be a ventilated pit latrine or pour flush standing toilets with a septic tank and a leach field. And part of this will depend on space, as well as what type of ground is underneath. I realize if you're in a low-lying coastal area, a normal pit becomes very difficult. So you have to think about other options, partially because you have a very high water table, and partially because flooding is a huge risk. At a minimum, there should be 3 to 4 toilets, 1 to 2 for staff, as well as 1 for male and 1 female patient. Okay, so this is my last slide before I share with you some of the key resources. As stated, the existing WHO guidance applies. We're not recommending anything new or anything different, but we are saying that the COVID presents an opportunity to better invest in, plan for, and think about longer-term sanitation solutions. Obviously, staff and any patients, in particular COVID patients, should have separate toilets, and this is really important to prevent healthcare workers from becoming infected and then becoming vectors to others. But it's also important that the patients the COVID patients, ideally, they are not sharing toilets with any other patients. And where private toilets aren't possible, and I know that's the case in many places, the attempt would be to at least have all the COVID patients use one toilet. But a toilet is not enough. We're not looking just for a toilet bowl or a slab. That there's the whole chain of safely collecting, transporting, storing, and treating fecal waste is really important. Regular cleaning and maintenance of the toilet is key. It seems to be the one thing that, at least in our visits of healthcare facilities, we find that are blocked, not working, and it means that then people either have to defecate in the open, or they have to use a different system that could be posing even more risk, not only to themselves, but to the community. And then just lastly, I'm really glad that, and it was upon Kate, because she's leading our work on AMR, that we're talking specifically about AMR as well, because we know that one of the primary ways to control the spread of AMR is through safely managed sanitation systems. And this means that the National AMR Action Plans ideally should be specifying what measures and what actions can be done on sanitation, and ideally linked to investments as well as monitoring on that as well. So my last slide, and again, these are all on the WASH and HCF website, so you can take a look at all these resources, give the key resources for sanitation, as well as more generally on WASH and healthcare facilities. So with that, I will hand it back to Lindsay. Thank you.
Thank you so much, Maggie and Kate, for that comprehensive summary. We tend to focus on the indicators in the JMPs, so I think it's really interesting to speak about these other critical components of sanitation and safely managed sanitation in healthcare facilities. So thank you for that and those great resources. If you have any questions for Kate or Maggie, please feel free to put them in the chat box. We will have a question and answer session at the end. If you could select all panelists when you are putting in your question, that way the speakers can see your questions in advance. So now we're going to turn to hear from some country perspectives. I know connectivity can be an issue, so we're going to try and hear from as many as possible. In particular, Nash, if you are online, we don't see you, but if you are online, if you could send a message to the WHO team, then we can make sure we make you a panelist. In the meantime, I'd like to invite Dr. Do Man Kuang from the Ministry of Health of Vietnam to take the floor. Doctor, it's over to you.
Thank you. Can you hear me?
We can hear you perfectly.
Okay, thank you. So in my presentation, I would like to present some information about the sanitation management in the context of COVID prevention in Vietnam. So next slide, please. Next slide, please. Okay, thank you. So as you know, in Vietnam at this moment, Vietnam has a very low number of cases of COVID-19. So up to date, there are around 207 COVID-19 infected people, and also 80% of them are recovered, and 51 COVID patients are still sitting in the hospital, and no one died from COVID-19 in Vietnam. And in the fighting with COVID-19, the Ministry of Health and DMR already issue many regulations and guidelines to control COVID-19 infection in healthcare facilities, and also the spread of COVID in the community. And the guidelines have been applied for healthcare facility, quarantine and isolation facility in the hospital, and also in the hotel or in residence area. And sanitation, hand hygiene, and environmental cleaning are important issues of the guideline and regulation. In terms of sanitation management, we focus on some key issues. For example, the first one is availability of sanitation facility in healthcare facilities, and in quarantine or isolation rooms and isolation facility. We regulate that all the facilities should have toilets in all functioning units or rooms, and the toilets should be enough for the demand of patients and visiting people and health workers in the healthcare facility. And for hospital, having isolation room for COVID patients and suspected people. We request that all toilet for COVID patients and suspected persons should not be shared with other people, and also the pathway to the toilet should also not be shared with others. And in isolation facility managed by the military, sanitation facility can be fixed toilets, or if the facility have no available toilet or number of toilet is not enough for many people, a mobile toilet can be provided for the facility. And secondly, we request all toilets in the facility should be easy to access for the user, and ensuring private for male and female, and the toilet should have enough soap, clean water, and toilet paper for user. And also instruction for 6 steps how to hand wash with soap should be available at area where easily to see. The toilet also should be cleaned at least 5 times per day. And whenever the toilet is contaminated by excrete or by vomit or by body fluid, in some hospital cleaning while having COVID-19 patient, they clean the toilet at least 4 times per day. And disinfectant solution containing 0.05% of active chlorine is used for cleaning all surface, including high-risk surface, for example, floor or water flush button or water tap or door knobs in the toilet. Next slide, please. Requirement for specific sanitation management for COVID patient and suspected person are the same what I have taught, but there are some more specific requirement. For example, all waste generated from the toilet of the COVID patient should be collected and disposed as infectious waste. And the cleaner should wear full PPE, personal protective equipment when cleaning the toilet, and to avoid infection. On the other hand, they should be trained on how to wear the PPE, or how to remove the PPE, or train how to prepare the disinfectant solution, and how to clean toilet properly to prevent themselves from COVID-19 is needed. Thank you.
Thank you so much, Doctor. Much appreciated. And we appreciate your insights on how not only the access, but also the quality in particular related to COVID-19 patients. I think that's so important and something that so often overlooks. For those of you interested more on environmental cleaning as it relates to not only the sanitation facilities, but the wider healthcare facility, you can visit the Washington HCF website to see the previous presentation earlier this week on environmental cleaning as it relates to COVID-19. So I'd like to now turn it over to Abdul Nasir Mohammed, the Country Director for WaterAid Ghana, to give some country perspectives. Nash, over to you.
Hello, can you hear me?
We can hear you just fine, thank you.
Great, thank you very much. So let me just take you a very quick tour of some work in washing healthcare facilities, especially in some of the remotest parts of Ghana. We have so many healthcare facilities or health centers that lack water, sanitation, and hygiene. And we know that in situations where people or healthcare seekers go to a healthcare facility and they have no place to wash their hands, they have no toilets where they can step in and feel that they have privacy, they often do not want to go to those healthcare facilities and would rather want to manage their health challenges at home. In situations like that, and in the face of COVID-19, there's going to be rapid spread. And what we're most scared of, because it's difficult to handle, is a community level infections. So if we do not have sanitation facilities in healthcare facilities, especially in rural areas, we're going to have major challenges. What we're looking for, that for every healthcare facility, either at rural level or urban level, that there must be a number of toilets that are well labeled, for men, women, and especially for those who even visit the healthcare facility. You know, when people go to the health center and are either admitted or so you have families, parents, friends visiting. You know, when they also come and do not have access to these basic services, they either go home with health center acquired illnesses, or as they come there, they introduce diseases and so on. In this phase of the virus, we're even more concerned that if these sanitation services are not made available, there will be rapid spread of COVID-19. And let me just add that some of the big challenges that we face around cleaning, keeping those health centers very clean. And I'm happy that the last speaker mentioned the need for thorough cleaning to be done on a regular basis. But here is a case where even the basic detergents for cleaning is limited, and sometimes the rural health centers lack these. You know, they rely on community members making donations to support them. You know, going forward, and in this particular phase where we're faced with this pandemic, it's non-negotiable. All healthcare facilities must have the basic detergent to be able to practice cleanliness and then make sure that all these facilities are safe to use. Even though this is about sanitation, let me just make a bit of a tour to water. If you want to practice effective hand washing, make sure that toilets are running, are clean and safe to use. We need to have water, regular water supply. So we need to begin to think creatively about how we can ensure that health centers have water supply 24/7. Solar systems are becoming very common. They may have an initial high capital outlay, but once they're set up, you know, their utility is unbelievable. So that's something we need to begin to look at. Last but not the least, I think the segregation of waste is also very, very important. You go to a number of healthcare centers, even at the urban centers, that they do not separate waste. And secondly, waste disposal is another major challenge. They do not have incinerators. If they have incinerators, they're not functioning. You know, so in situations like that, healthcare givers, frontline health providers are even at risk, and that compromises the quality of care that they give. You know, so we need to make sure that it's a total package. You know, there's water, sanitation, there are hand washing facilities, then we can be sure that we are dealing with cases properly and actively. Otherwise, we're going to be faced with multiple infections that would spiral out of control. So these are just snapshots from some of our work. But the PPEs are beginning to spread in urban centers, but we want to see more going down to some of the points where they are in most need, you know, especially in the rural areas, especially in areas where you have porous borders and you have a lot of people creeping in and then ending up in healthcare facilities that do not have the capacity to respond. You know, we need to make sure that we prioritize them. Thank you very much.
Thank you, Nash. And you made such an important point about the fact that, you know, we were talking sanitation today, but it is so much more holistic than that, that the elements of having water and having the hygiene available are all really a package to be able to do this safely. So thank you so much for your insights from Ghana. I want to turn to one more country perspective. We have Quincy T. de Gaulle on the line coming from WHO Liberia. Quincy, can you hear me? I can see that you're on. Maybe if you unmute yourself, we'll be able to hear from you.
Okay, so let me.
Oh, wait, I heard you for a second.
Oh?
Yep, I can hear you perfectly. Great.
All right. So, hello, colleagues, and this is Quincy Gore from WHO Liberia. I will be filling in for Jefferson Download, my colleague from the Health Ministry. So currently, I'm actually in the field and traveling back to the city center from the WASH and IPC case management healthcare workers capacity building in the context of COVID. So I'll just briefly give you some of the challenges we have, especially when it comes to sanitation in healthcare facilities from Liberia. Am I clear?
Perfectly clear. Go ahead.
All right then. Okay, so I mean, there are a couple of challenges we currently have, even though we still trying to see how best to cope with the prevailing situation. When it comes to the issue of sanitation in healthcare facilities, there are great disparities from rural and urban facilities as per the survey just being conducted on the trip we just ended. Uh, we will probably try to discuss it from the rural and urban angle in terms of the so most of the health facilities that we find actually have sanitary facilities being constructed. And one of the issues that we currently have as a challenge is that most of the facilities, like they are out of use in terms of constant usage. Most of them need repairs. In terms of probably separation from females and males, yes, they actually practice that those indicators are actually being met from time immemorial. But most of the facilities are being like out of use currently that really need government attention in terms of trying to rehabilitate those facilities. And so those are some of the issues we have currently. One thing that still remains is challenged is we still do not have menstrual hygiene separation in terms of the sanitary facilities. That's the latrine. That's one of the challenges we still have in Liberia. And in the face of COVID, one of the issues that we have, and we were kind of grateful for the government quick interventions is one of the POCs. For us in Liberia, POC is the Precautionary Observation Center in the face of COVID. So currently what the government does is that most of the COVID cases we have, I actually treated at the 14 military hospital, exclusively used just for that purpose, and other few facilities that are just exclusive for COVID. So we do not actually treat COVID cases in facilities that other care attendants will actually go. So one of the challenges, or some of the challenges we actually have at these facilities are to have separated latrines or bathroom because they were not actually constructed for those purposes. And as you all know, the cases we currently have in Liberia are increasing. So we do not have so many facilities like dedicated to that purpose. So we have like the 14 military hospital currently overcrowded in terms of the number of patients that are there. And so the latrine system is not too conducive. That urgently need government attention. For rural communities, there are few counties currently that have cases. The cases are not so many, and most of the cases are now being transferred to Montserrat that actually have the facilities for holding the cases. So for the rural communities, the only thing we have is that the guys do triaging. That is a holding center for some of the probable, the confirmed cases. And what we noticed from the surveys we just have is that most of this triage do not have something like a separated latrine just for patients that probably are probable cases or confirmed cases or suspected cases, which is a huge challenge. So that could be a point of transmission if suspected cases or person with a suspected case is also using latrines or bathroom that are also being used by people that do not have those cases. So those are some of the issues we are faced with currently in Liberia, and there are so many more. When it comes to waste management, most especially as we run to the rainy season, is a challenge. That the waste generation currently has increased. The number of probably loads that are being transported to Disco Hill, which is the central waste treatment center, has increased. And there are limited logistics when it comes to government support to collecting and safely disposal of healthcare waste. So with the incoming rainy season where some part of the centers will be stagnant water, which is also a bad thing, it's going to be a challenging thing is something to really give a quick attention to. So on this training, we were able to administer some of to some of the healthcare workers the waste segregation and safe disposal, and also trying to see how best to give them the best innovation in terms of where there is no incinerator or demo for to treat the waste, how best they can treat the waste and safely dispose the waste before it enters into the community. And so the routine monitoring in terms of widespread is actually going on, but we go doing it alongside the emergency response. So those are some of the challenges we currently have, and we're trying to, work with state government and some of our partners to see that we go into those rural areas to see that those facilities that have those challenges, they are quickly, being reached.
Thank you, Quincy. We really appreciate that, the insight from the field. It sounds like there's so much going on, and it literally sounds like you are coming from important work right now. So
I'm actually traveling, coming back to town, so I don't know if I'm so clear or the internet is actually having a problem.
No, we heard you perfectly, and I so appreciate hearing, right from the activities itself. So I do want to turn over for the final 10 minutes an opportunity for questions from the participants. So please feel free to put your questions in the chat box if you have any, and we can have any of the panelists respond. One of the questions that keeps popping up, and I know, Maggie, you already responded to it in the chat box, but I think it's so important, is this question around whether or not the guidelines apply to the COVID-19 situation, and are there additional measures needed, particularly as we think about sanitation facilities?
Sure, happy to start, and assuming Kate's still online, we'll let her fill in. But yes, the guidelines do apply, and I really appreciated your point, Lindsay, that this goes beyond the JMP indicators, which are important about access, but all the other things that happened after you have access to the toilet around conveyance and storage and treatment and final disposal are really important. So it's actually an opportunity to try to tackle some of those broader issues that will be important, not only for COVID, and I just do want to emphasize that the virus is particularly fragile. The envelope is such that it can be easily penetrated, and it has a much shorter survival than other fecal oral non-enveloped viruses. So, by treating your sewage safely, you're certainly going to be protecting against COVID, but you're going to be helping protect the community, and especially at the healthcare facility where people are more vulnerable to disease from many other fecal oral pathogens. I'll stop there and see if Kate has anything else to add.
No, Maggie, that's exactly right. And actually, if we look, our data shows this, and it, many of you from your personal experiences, what's happening in so many facilities is really less than safely managed services. So we can use the opportunity of COVID to shine a spotlight on this and do the things that we know need to happen for disease control and making sure we have kind of safe and dignified facilities. But I think there is like a specific extra thing for cleaners. We need to make sure that they have their PPE and that they don't become at risk themselves or vectors of disease themselves. So some not necessarily extra protections, but really making sure that these people are part of the efforts to prevent infection within healthcare facilities.
Great, thank you both. It sounds like it's not so much new SOPs, it is actually following the SOPs and working as teams to make sure that these are routinely put in place. So thank you for those thoughts. We also had a question that, Maggie, you sort of touched on at the beginning, but perhaps you and Kate want to go into a bit more detail. The question about dispersing, how to treat gray water before dispersing the soil. In particular, this commenter was coming from Cox's Bazar, where the site is very dense and there's no possibility to build large infiltration ponds. So I wonder if you have any thoughts on sending water to this, sending this water straight to surface drainage.
Sure, maybe I'll jump in there again. And again, please, Kate, come through with some more specific examples. I mean, as I said in the chat, gray water generally will have very low risk of fecal contamination, but it's really important that you make sure that there isn't any place in the system where the gray water has been mixing with the black water. It's particularly true in situations like COVID or other infectious disease where we see more use of chlorine for disinfecting surfaces and disinfecting even potential PPE. That said, there's obviously concerns about having standing water, which can attract mosquitoes and other disease vectors. So it's tricky in a situation like Cox's Bazar, and I haven't been there, but I've seen a lot of photos where it's quite hilly and it's very densely packed. So I think thinking about, what type of plumbing options you may have to be able to convey water to a site where it can realistically flow into an uninhabited area, and also to make sure it's not flowing directly, for example, into latrine pits or other sewage works, which could then cause black water to overflow. I'll hand it back to Kate.
Yeah, just to reinforce exactly, the priority needs to be on treatment of the black water, and if you can do grey water separation, that's a bonus to permeate into the soil if you can, and if not, then drainage away, and preferably through covered drains. But just remembering that, when we talk about the various barriers we can put in place, they don't always have to be infrastructural barriers. So if you do have, grey water running into open drains on the street, you can think about, public communications and other measures that might prevent exposure to that. While, some of these technology-based solutions are, desirable, we can look at a number of different ways of preventing exposure.
Thank you both. I have two questions that I think are, Maggie, pretty important, and they, perhaps for people who are less sanitation experts, we have some health people on the phone here. One question, does sanitation include wastewater in healthcare facilities? And secondly, a question around the separate toilet facility for persons with disabilities not considered for the global monitoring indicators.
Sure. On the first question, yeah, I mean, sanitation can be interpreted quite broadly, right, to mean everything from solid waste, including healthcare waste, as well as sanitation generated through excreta and fecal waste. In WashFit and in particular within WHO, when we're talking about sanitation, we're really focused on excreta and black water sewage. So, yes, healthcare facilities do need to be thinking about this and what happens to that excreta after it goes through hopefully some kind of toilet or latrine. Sorry, can you remind me? I just blanked on the second question.
Second question is, why is it that a separate toilet facility for persons with disabilities was not considered for the JMP monitoring indicators?
Yeah, I guess for us, we're very conscious, especially in the very small in very small primary healthcare facilities, which the example I gave, you may have one day where you have a huge amount of visitors, but the other days your visitors are quite low, that it could very quickly become very cost prohibited to have separate toilets for every particular need. Very much we emphasize that one of the toilets needs to be a toilet that is made accessible to those with limited mobility. And obviously in a hospital or a healthcare facility where you have many more users, it would make sense to have a toilet dedicated in particular for those kinds of users, because the other toilets obviously are going to be used more frequently, but also you may have, more people with limited mobility. So I think it's very context specific, but regardless, one of the toilets needs to be accessible, and whether that's a separate toilet or, a part of, an existing toilet, I think it really depends on the type of facility and the users.
Great, thank you, Maggie. And I'm going to close up here and hand it over to UNICEF in a moment, but I did just want to say, for me, this has been such an interesting takeaway around how important the existing guidelines are and how we need to really put these standard operating procedures in place for COVID-19, making sure that we're not just looking at the basic JMP indicators, but really looking at safely managed sanitation as a whole in healthcare facilities during this outbreak. So we did have some questions that touched on hygiene and on healthcare waste management, and I did want to remind you that there are webinars on both of those topics that you can find on washingtonhcf.org. The recordings are on YouTube, so please visit those to answer some of those questions. And then UNICEF, we have Irene Amongden on here. Irene, would you like to make some closing comments? Irene, you're still muted.
Hello?
Great,
Hello?
we can hear you now. Yes, please go ahead.
Oh, I'm so sorry. I thought I had been unmuted. Thank you so much, Lindsay. So this is Irene again from UNICEF HQ in New York. I'm really excited to see that you have all been available and participated in all of the webinars on this series. I mean, I can't see how many people are on this webinar, but I can see from the exchanges on the chat box that quite numbers of people are on this call, but also in the previous call, in the range of maybe 200 persons or so. So really exciting to see that you have worked with us throughout this webinar series. And so on behalf of UNICEF and WHO, I just would like to say thank you to all of you for joining today's webinar and for joining the last webinars on the series. So in today's webinar, we looked at different things from the guidelines to sanitation and health and different technologies for different healthcare settings and the risks to waste collection, the climate risks, and also climate risk, climate resilient technologies for consideration. I won't go through all of these things, but I just wanted to say that sanitation is one of the most important aspects to provide quality services in healthcare facilities, as you can see from the submissions from the different speakers. And I think one of the speakers spoke about how poor sanitation impacts on care-seeking behavior. And I just wanted to reiterate this point, especially when speaking about expectant mothers, whom most of us know from experience that they prefer to deliver from home if there are no wash services, especially sanitation services for mothers to take care of themselves at the time they're admitted in hospital to deliver their babies. And so they prefer to give birth at home, which endangers both their lives and that of their babies. So one of the things I also just wanted to say is that I think Maggie did speak to the risk involved on transmission of COVID via the fecal route, which is said to be very low. But I just wanted to say that, while this might be the case, let us remember that it's very important still for us to provide good sanitation services for people who seek care in healthcare facilities to ensure that we mitigate the risk of infection, not just from COVID, but also other infections from different routes or different factors. And for us to be able to provide good care to patients who seek care in healthcare facilities. And one of the final things that I wanted to mention is that while we recognize the limitations of resources in some of the countries that we work in, I just wanted to emphasize how important it is for us to link interventions in the response to long-term sustainable wash solutions. I think what we heard from one of the speakers about climate risks and how this impacts the provision of wash subsidies in healthcare facilities, but also I think the current pandemic reminds us of history. I think most of us have heard about the Spanish flu of 1918. And so I think the question for us now is how do we prepare for future pandemics should they reoccur? And I think the answer is in the quality of services that we provide now. Just to emphasize the importance of ensuring that whatever interventions we make should be interventions that can be sustained over time to ensure that we provide quality services to patients. And lastly, I just wanted to say that throughout this webinar, including today's on sanitation, we have had we've seen a lot of guidance and resources shared, which are at our disposal. And I just wanted to urge you to make sure that you make use of these resources because they provide a lot of information, guidelines that we can use to provide interventions in healthcare facilities, and especially now with the current pandemic, which we all know is very we don't have a lot of information about it, but I think we all know that the transmission rates are very high via human to human, and so it impacts both the healthcare workers, but also, of course, the patients and the communities around these healthcare facilities. So very important for us to ensure that we make use of these guidelines to ensure that we provide the best wash services possible that we can. So thank you so much again for participating into this webinar, and we look forward to connecting with you on the next webinars. Thank you. Over to you, Maggie.
Thank you, Irene. Just a reminder for you all that the WashingtonHCF.org/resources, if you search COVID-19, you can find all of the slides from this webinar as well as from the previous webinars in the series. And if you go to youtube.com and search UNICEF, WHO, Washington HCF, you will find the channel that has the recordings. The FAQ document that will pull together the questions unanswered from these webinars will be put together by Deputy Chair UNICEF and sent out with a newsletter and uploaded on WashingtonHCF.org. So thank you again. Apologies for going a bit long, but we appreciate your active participation and we look forward to seeing you again soon. Take care.
Okay, goodbye everyone. Have a good rest of the day. Thank you.